Many people addicted to drugs may have an undiagnosed mental disorder. They are addicted to drugs not of their own will, but due to the challenges of ill mental health.
I discovered that I was not a social drinker, because I would go to alcohol even during the day, morning hours, on my way to school. So yeah, it started messing up my life.
John Karonji is 24, a former university student who was pursuing a bachelor's degree in business IT. He started using alcohol at the age of 16.
At first I was enjoying, but then I realized it was an issue because my life seemed to stagnate. But I didn't know that it was a condition.
The intention is to medicate the mental health symptoms that they find disruptive or uncomfortable. If suffering from an anxiety disorder, for example, they may use alcohol to feel more comfortable, or a depressed person using marijuana to numb the pain.
You have used a stimulant which takes you high. Then at the same time, you are using a depressant which will take you down. Then it's like you are confusing the whole system, the brain system.
Many could not understand what was happening to John. He was branded an alcoholic, something that led to him being expelled from university in second year.
Initially, I didn't know that it was a problem, but now that I came here, I've seen doctors and medical staff, and they've explained it. They say that I have a condition that is depression, so it's like I used to take alcohol to mask it.
A wake-up call came for John when he was unable to progress anywhere after expulsion from university. John started with detoxification at Mathare Hospital.
I went for detox, whereby there was a certain injection for 5 days. Then after that, there were some medications to reduce the urge, because at that time I was very fresh. When I came here, I was very drunk. So yeah, it was a detox kind of a phase.
In our setup, the rehab takes 90 days. Those are 3 months. And many times after detox, some of them are not still okay. So they will take like a month before you can see that sign of somebody stabilizing.
When symptoms of mental illness such as paranoia, anxiety, delusions, or hallucinations last longer after the drugs wear off, this may point towards an underlying mental illness.
An addiction, we say, is a brain disease that is chronic and relapsing in nature. So, you know, like many other medical conditions that are chronic and are likely to relapse from time to time. And so it is the case with addiction that we are fighting.
Social support right from the family setup and not being judgmental is important for anyone with a substance addiction, particularly if the use of the drugs is as a result of a mental illness. Karonji's family at the time thought that he was a menace. That did not make him feel any better.
At first, they didn't know what I was suffering from, so they took it like I was ignorant and you know, a sort of a menace. But after coming for treatment and they were explained to, I think they have taken it quite well now.
An untreated mental health disorder makes it hard for the patient to overcome the substance use. Alternatively, an untreated substance use complicates treatment of a mental disorder. Dr. Mercy Korir for Health Digest, KTN News.